cut my hair. Looks nice, doesn't it? But it was so overdue. And one of the reasons that I wanted to cut my hair was because it was so long, and it was heavy, of course, because it was so long. But I also thought, what if I keep waking up with a headache because I keep sleeping on my hair, or my partner keeps sleeping on my hair, and therefore I am overextending my neck, which gives me a headache. Because when I get a headache, it doesn't just hurt my head. But actually what happens is that it hurts here, and I have a lump here, and that kind of spreads out to my jaw, and then my shoulders, and my neck, and here, and my head. And I was thinking, what if that happens because I keep overextending my neck because of my hair? So I decided to chop it all off, and actually I think it looks much better this way. I can actually swish my hair again. But anywho, I was thinking this could be a symptom of Ehlers-Danlos Syndrome. Just like loose joints, chronic pain, stretchy skin, and headaches. And in more extreme cases, even dislocations or subluxations of joints. Hi, welcome to Minerva. I'm Vera, and on my channel we talk about everything disability related. If that is something that you would like to know more, then make sure to like and subscribe, because it really helps my channel out. Having said that, I have a lot of doctor's appointments coming up in the next month or so, and I'm talking 3 per week, so I'm not entirely sure what my uploaded schedule will be like in the next month. But I will try to upload a video every Tuesday night, as always. So today I am wearing a black top, space trousers, and I'm sat in front of a white wall with some artwork, and there's a plant to my right. Disclaimer, I am not a doctor, and I am certainly not your doctor. So this video is not meant to be medical advice. But if you do recognize yourself in these symptoms, it might be worth talking to your GP about them. All of my sources are linked in the description box down below. I need to also put a disclaimer out to say that there are 14 different types of Ehlers-Danlos Syndrome, and it is simply impossible for me to talk about all of them in this video. If you would perhaps like a video in the future about other types of Ehlers-Danlos, then let me know in the comments. In this video, I will get into the symptoms of the 3 most common ones, but I will also make sure to leave a link to the symptoms of the other types of Ehlers-Danlos Syndrome down below in the description box. So, what is Ehlers-Danlos Syndrome? Ehlers-Danlos Syndrome is a genetic connective tissue disorder. And as I said before, there are 14 different subtypes of it, each with a slightly different presentation. But one thing we all have in common is weaker connective tissue, which leads to general widespread hypermobility, which basically means being able to stretch your joints further than you are supposed to. So the way that this is tested is by using the Baton scale, which is not without its own issues anyway. The Baton scale tests the hypermobility in your thumbs, your pinky, your elbow, your knees, and your hips. However, depending on what type of Ehlers-Danlos Syndrome you have, your hypermobility may be more concentrated in your smaller joints rather than your big joints. You also may not be as hypermobile in your upper body, because the Baton scale does predominantly test the hypermobility in your upper body. You might be, for example, not be that hypermobile in your thumbs or your elbow, but you can be extremely hypermobile in your ankles, your knees, and your hips. Additionally, because it does mostly test the hypermobility in your upper limbs, it can't really say a lot about widespread hypermobility or generalized hypermobility, so throughout your entire body, because it just simply doesn't test for it. There are more and more voices in the medical Ehlers-Danlos Syndrome community that want to move away from just using the Baton scale as a measure of hypermobility, and instead would also like to incorporate other different tests, like the Hospital Del Mar criteria. The criteria for Ehlers-Danlos Syndrome are arbitrary, which means that your doctor needs to use a certain type of discretion when diagnosing you anyway. Another thing that weaker connective tissue can lead to is skin flexibility. But again, sometimes with Ehlers-Danlos syndrome come with extreme skin flexibility, whilst others just come with a little bit. And the third thing that weaker connective tissue can lead to is a fragile skin that breaks and bruises very easily. Now, personally, I bruise just by looking at things. It is important to know that every person with Ehlers-Danlos syndrome will present differently, even if you have the exact same type. Some people with Ehlers-Danlos syndrome have a relatively mild form, whilst others, like me, have a more severe type. It was thought that Ehlers-Danlos was a very rare disease, but actually there's more and more evidence that suggests that Ehlers-Danlos syndrome is actually not rare at all. It is just severely underdiagnosed. This does also depend on what type you have though. Some types just are rarer. Hypermobile Ehlers-Danlos is by far the most common type, and it is also considered to be the most mild form because it isn't lethal as such. But that doesn't mean that it can't be disabling, of course. So let's get into the details. I don't know if you can tell, but my voice is a little bit wrong today, so I might sound a little bit hoarse or out of breath, or just know that that is just my voice. I'm okay. So let's get into the details. People with Ehlers-Danlos have wide, chronic pain throughout their entire bodies. For some people with severe Ehlers-Danlos syndrome, which I from now on will refer to as EDS, have frequent dislocations or subluxations without any trauma. However, not everyone with Ehlers-Danlos syndrome has any dislocations at all. We will have joint pain and joints that click, which is really fun. For example, when I go up and down the stairs, I just sound like a skeleton. And I always have, even as a child. We also have skin that bruises easily and extreme tiredness, fatigue. However, because everyone has connective tissue all throughout your body, EDS doesn't just give us skin and joints issues. People with hypermobile EDS can also have digestive issues such as heartburn and constipation, dizziness and an increased heart rate after standing up, problems with internal organs like mitral valve problems or organ prolapses, problem with bladder control, urinary incontinence. The symptoms you have depends on which type of EDS you have. There are so many more symptoms, which we will get into a little bit later. And some of us have symptoms that can be indicative of multiple types of EDS, like me. We do know some of the genes that are responsible for the other types of EDS, but we don't yet know any of the genes that are responsible for the hypermobile type. Unfortunately, according to my geneticist, because we don't yet know all of the types of genes that are responsible for all of the types of EDS, a genetic test is not yet definitive proof that you might not have a certain type of EDS. It can just prove definitively that you do have that type. Let's now look into some of the symptoms for classical type Ehlers-Danlos syndrome. Loose, unstable joints that dislocate easily, joint hypermobility, stretchy skin, fragile skin that can split easily, especially over the shins, the forehead, the knees and elbows. Smooth, velvety skin that can bruise easily, wounds that are slow to heal and leave white scars, hernias and other organ prolapses. Then there is the vascular type of Ehlers-Danlos syndrome. This one is considered to be the most lethal because it affects your blood vessels and your organs. And people with vascular Ehlers-Danlos have a fragile skin that bruises easily, arterial rupture at a young age, thin skin with visible small blood vessels, especially on the upper chest and upper legs, fragile blood vessels that can bulge or tear, resulting in serious internal bleeding, a risk of organ problems such as the bowel tearing or the womb tearing later in pregnancy, and partial collapse of the lung, hypermobile fingers and toes, unusual facial features such as thin nose and lips, large eyes and small earlobes, varicose veins, and lastly, delayed wound healing. As I said before, because Ehlers-Danlos is a connective tissue disorder, and connective tissue is found all throughout your body. People with EDS might also have trouble sleeping, either insomnia or hypersomnia, non-restorative sleep, sleep schedule disorder, excessive sleeping throughout the day, sleep apnea, and restlessness. We may also have vertigo, arrhythmia, trouble with your jaw, as I'm having right now, constipation, depression, malabsorption, migraine and other types of headaches, nausea and vomiting, abnormality of the gums, atypical scarring, scoliosis, trouble swallowing, and various bladder issues. Now, Ehlers-Danlos Syndrome also comes with a host of embarrassing issues. For example, pain during P&V sex, or something like dislocating your hip also kind of ruins the mood. Some other things can be a higher rate of vaginal infections or a higher likelihood of developing bladder infections. As you can see, there are so many different symptoms which can make Ehlers-Danlos Syndrome such a difficult disease to diagnose. In our modern healthcare system, every issue is being treated by different specialists, but that can make it very difficult to make the connection between joint hypermobility, scoliosis, headaches, and jaw problems, for instance. EDS also comes with a host of comorbidities, meaning conditions that can co-occur. These are things like autism and ADHD, or dyslexia and dyspraxia, but people with Ehlers-Danlos Syndrome have a higher likelihood to be neurodiverse. MCAS, or mast cell activation syndrome, an abnormal response in the mast cells in your body, which can lead to allergy-like symptoms, but it is not an allergy. This can result in anaphylactic shock, dysautonomia, and mostly POTS, postural orthostatic tachycardia syndrome, which is the lowering of blood pressure within 10 minutes of standing, which can lead to fainting, dizziness, or feeling faint, amongst other things. It can also come with gut dysmotility, or something like gastroparesis, for example, which is the slower emptying of the stomach, which may result in being nauseous, vomiting, and feeling bloated, or being able to only eat a small amount of food at one time. EDS can come with anxiety disorders and depression, or irritable bowel syndrome, or cervical cranial instability, which are complex problems caused by joint instability at the top of the neck. These are just some of the comorbidities that can occur with EDS. There are so many more. Even though I didn't get diagnosed until I was 24, I had a range of symptoms in my childhood. And throughout my childhood, I was given therapy to kind of correct these issues. But no one really thought to look why I had these issues in the first place, which is why I think that it's so important to talk about Ehlers-Danlos Syndrome. It is a difficult disease to diagnose because it's so widespread throughout the entire body. The only reason why I am diagnosed in the first place is because I found this information online and then went to my GP to ask if it could be possible that I had this. So, although I am not a doctor, I do want to spread information about Ehlers-Danlos Syndrome. If you identify with these symptoms and you would like to check if it could be possible that you have it, I will link the diagnostic criteria down below so you can take that information to your GP. This is why I believe that self-diagnosis is an important first step to your healthcare. It shouldn't be, but it is. Anyway, this was it for this week. I hope you could follow along with my voice issues and my jaw issues, but that is the life of someone with Ehlers-Danlos Syndrome, and I think it's important to show you also, or maybe especially when I'm not feeling so good. So that's why I wanted to film today anyway. I hope you liked this video, and I hope that this video was useful to you. I will see you next week, hopefully feeling a bit better. Bye!